Part of the reason why some people are hesitant is because they see this vaccine-only narrative. When you're talking about non-communicable diseases, for example, hypertension and diabetes, we talk about a holistic approach. We talk about diet, we talk about exercise, we talk about stress management, we talk about the environment. There is nothing about that coming from authorities, not just locally, but even internationally. There's a push by the authorities to get vaccinated and to wear the mask and the public health stuff. We know this. But when you look at countries, for example, like Gibraltar, where 100% of the adults are vaccinated and they still have a problem, or Israel, that is significantly vaccinated and we still have spread, we're going to need more than the vaccines. And you're talking about the hesitancy. Part of the reason why some people are hesitant is because they see this vaccine-only narrative. When you're talking about non-communicable diseases, for example, hypertension and diabetes, we talk about a holistic approach. We talk about diet, we talk about exercise, we talk about stress management, we talk about the environment. There is nothing about that coming from authorities, not just locally, but even internationally. And there's research to back this up. So for example, there was a study in South Korea, 200,000 people showing that people who exercise regularly, when they do get COVID, their morbidity tends to be much less. Another one from 40,000, Kaiser Permanente Clinic in San Diego, 40,000 people. If you have a sedentary lifestyle, your risk of getting very sick, very high. There are multiple studies showing that if you're obese or overweight, your risk of severe morbidity is way higher, even if you're a young person. Multiple studies have shown that if you're vitamin D deficient, your risk of severe morbidity is high. So what we need is to let people know, yes, get vaccinated, because vaccination makes a huge difference. 70% of Jamaica is fully vaccinated.
But
only 2% of the people who died from COVID were fully vaccinated. It's a huge difference. The data speaks for itself. So getting vaccinated reduces your risk of severe morbidity and death, but we need more than that. We need to take responsibility for our own health. We need to educate people about early treatment. That's another thing. There's this kind of binary thinking that some people think you're either for the vaccine or you're for early treatment. I'm a physician. I support vaccination strongly, but I also support early treatment. And there's a gap in management where when people are diagnosed with COVID and they are told, guess what? You have some sinus problems and your test came back positive, so stay home for 2 weeks and just let me know if you get worse. We need to let people know what they can take to affect their immune system or viral replication or inflammation, whatever, and let them know that you need to be in contact with a physician on a daily basis. You need to monitor your oxygen level.
Yes.
We need to let people know this because many people who die, they die because they reach hospital late.
Yes.
They're at home for a while. So we need a multi-pronged approach. It has to be a multi-pronged approach.
very well. Dr. BISASOR McKenzie, we're heading into the fourth wave. Exactly how are you preparing?
Well, in terms of the fourth wave, what we have to make sure is that, first of all, we are imploring people to get vaccinated to protect especially the vulnerable population. The public health measures in terms of the wearing of the mask, physical distancing, hand sanitizing, all of those are still there, so we encourage persons to do that. We also are preparing in terms of our hospitals to make sure that we have all the supplies that are needed.
Oxygen included?
Oxygen included in terms of our main suppliers having that capacity to increase the amount of supplement their local production. So that is being done to make sure that we are prepared. But I do agree with Michael in terms of the other measures that people need to do to stay healthy, to make sure that they're taking care of any of their chronic diseases that they have, because we know that chronic diseases put you at an extra risk for severe COVID-19. So I would encourage persons to do that, and I would also encourage persons to eat healthy and exercise, and to encourage the physicians out there to encourage patients to do that.
But all in all, you're satisfied that you are prepared for a fourth wave?
Well, we can never be. We're doing what is necessary, but we can never be totally prepared, but we're certainly moving towards that. I don't think I can ever be comfortable because there's so much that is unknown. And when you have a new variant that is there that we're not sure exactly how it is in terms of transmissibility, certainly what we're seeing is that it appears to be highly transmissible. So we know that if it does come to Jamaica, and I shouldn't even say if, I should say when, that several persons will be affected. What I am hoping is that there will be, because of the level of vaccination, because of the level of precautions that people are taking, is that the epi picture will be a little bit different, because even if it is that this new variant has the same exact profile in terms of disease that it can cause, because many of our vulnerable populations would have been protected, many people are sensitized to the measures to be taken, then maybe it is that we won't have the level of hospitalization.
All right.
From the NHS perspective, the additional burden was to source and procure vaccines. And the early days were difficult, but I think the lesson that we have picked up at the NHF, and that I think the people of Jamaica should hear and digest, is that going forward, public health must become more significant and important in not only the government's policy making, but in the lives of ordinary people. We need to be much more focused on the care of ourselves, because, for instance, COVID is really a disease of the unhealthy. If you are healthy, your likelihood, vaccinated or not, your likelihood of dying from COVID is much less. And I think public health must become a more significant foundation stone in planning and in strategic implementation of government policy.